the analogy that I kind of thought was unique and interesting is that mechanic works on a car, the engine's off. When we do it, we're doing it with the engine running. And the idea that we can do that, we can take things apart, put them back together, remove things, diseased tissues or whatever, and have everything come back together and work better than it did before, really kind of started to fascinate me. And as that interest continued to grow, I started getting more interested in more specialized procedures, things that we would see commonly, but that most veterinarians aren't equipped to do in their own general practice, things that we usually end up having to send to somebody who has devoted their life to nothing but surgery. I started thinking about it and reading on the different topics, and I started thinking, this doesn't sound like anything that, with some training, that I couldn't do myself. One of the things that we see most commonly is what we call a torn CCL, ACL in human medicine, and I thought, well, there's no reason I can't do that surgery too. I got the training, and while it is a specialized procedure, it's a procedure now that we can do here to ensure that a dog that ends up running around with a torn ACL and very likely without treatment is going to be in some pretty substantial discomfort for the remainder of its life if it's not treated. That's something that now I can do here in clinic without having to send people down the road to a doctor they've never met in a clinic they've never been to with staff that they don't know. Now you can come in here with people that you know, faces that you see every time that you come into the clinic, and receive the same quality of service and the same level of care. In doing so, provide any patient with a torn ACL a lifetime of lasting comfort.